How does surgical excision remove warts? Imagine a tiny wart stubbornly sticking around on your skin. Surgical excision is a precise way to remove it by physically cutting out the infected tissue. The process begins with numbing the area using local anesthesia, so you feel minimal discomfort. Once numb, a healthcare professional uses specialized tools like scalpels, scissors, or curettes to carefully cut around and remove the wart. Usually, they take out a small margin of healthy tissue around the wart to make sure all infected cells are gone. After the wart is removed, the wound may be closed with stitches or left to heal naturally, depending on its size and location. This method directly targets the infected skin cells that harbor the human papillomavirus, which causes warts. In cases of genital warts, which are caused by certain strains of human papillomavirus, surgical excision is often chosen for larger, persistent, or obstructive warts that do not respond well to topical treatments. It offers immediate removal, with success rates reaching around 70%, but it's important to remember that the virus can still be present in surrounding tissues, so warts can sometimes come back. There are different ways to perform surgical excision. One common method is scissor or snip excision, where the wart is grasped with forceps and cut out with curved scissors. This usually doesn't require stitches and results in minimal scarring. Another technique is shave excision, where a sharp blade shaves off raised warts after local anesthesia. This method also typically doesn't need stitches. Curettage with electrocautery involves scraping off the wart with a curette and then cauterizing the base with an electric needle to destroy any remaining tissue and control bleeding. For more complex cases, or when cosmetic preservation is important, Mohs surgery may be used. This involves removing thin layers of skin and examining them microscopically until no wart tissue remains, minimizing healthy tissue loss. Most of these procedures are performed in outpatient clinics by trained healthcare providers. Recovery varies depending on the size and location of the wart, but generally involves caring for the wound to prevent infection. Patients are often advised to avoid strenuous activities and refrain from sexual intercourse until healing is complete, which usually takes about 1 to 3 weeks for genital warts. Common risks include pain, bleeding, scarring, and the possibility of wart recurrence, especially if the virus remains in nearby tissues. Surgical excision is especially valuable in sexual health because it provides a quick, effective way to remove visible genital warts. It reduces the local viral load and allows for tissue analysis if there's concern about possible malignancy. However, because human papillomavirus can stay in the skin beyond the visible wart, excision is often combined with other treatments and ongoing follow-up to manage the infection comprehensively. Always consult a healthcare professional for personalized advice and proper post-procedure care. In the end, surgical excision offers a reliable option for removing stubborn warts, especially when other methods haven't worked, and it plays a crucial role in managing warts related to sexual health and sexually transmitted infections.